Hi, I'm going to share on what is our preferred lens when it comes to laser photocoagulation. Now, of course, most of us are using a volk lens. In my hand, I have two lenses. The lenses that I like most, one is the Superquad 160 and also the HR lens. Now, if you look at the field of view when it comes to these contact lenses, both give you equal field of view, 160 degree. Because of the wide field view, obviously it increases the spot size every time you laser, so it increases by twice because it reduces the image size by half, which is 0.5. Let's make a comparison between these two when it comes to the diameter itself. You can see obviously the Superquad 160 degree is very big as compared to the HR wide field lens. Now, why is it called HR? It is actually a high resolution wide field lens. Now, when you look at the size of the aperture of the lens in contact with the patient's eye, it looks more or less the same size, yeah, between these two, exactly the same size. But when we look at the external diameter of the whole lens, obviously the Superquad lens is much bigger, more than 2.5 centimeter as compared to the HR wide field, which is just about 2 centimeters. So now what about the height? Again, if you look at the Superquad lens, the height is actually definitely almost 3 centimeter. For the HR lens, it is more or less about 2 centimeters. So what is the effect of this size when it comes to dealing with patients? Number one, if the size is small, obviously it can fit into the eye much easily, and it's also easy for us to manipulate as well as try to stabilize the HR lens onto the eye. And number two, because it's small, it is suitable for all our Asian eye, which has a small aperture most of the time, and also for our deep-seated eye patient, it is very useful. I had a few cases whereby they referred to me because of difficulty to laser a peripheral tear, but the moment we switch to the wide field lens, everything is done easily. So I do advocate all our general ophthalmologists to buy the HR wide field lens. It makes your life much easier. Yeah. Superquad 160 degree laser is still good, but when it comes to the peripheral retinal tear, I suppose HR wide field is much better. Give it a try. Thank you. Hi, I'm going to share on what is lens is much bigger, more than 2.5